Good morning, everybody. Good evening and good afternoon. So it's my pleasure today to moderate this second session of the European Climate Resilient Health and System course. So I am Ianis Delpla. I'm assistant professor from the French School of Public Health. And today we will have three presenters to speak about the methods for assessing vulnerability and adaptation of health systems. So just as a reminder, the general objective of this course. So this course is co-hosted by the Association of the School of Public Health in the European region and the Global Consortium of Climate and Health Education from the Columbia Main School of Public Health. So the global objective of this 10-session course is to articulate to key partners in the public the challenges unique that health systems will face in a changing climate, applying methodology and frameworks for assessing vulnerability and adaptation for health systems in any context. So that's the purpose of today's presentation. Apply approaches for measuring, monitoring the environmental sustainability of health system and health benefits of green health systems. Applying a health equity lens into efforts to address this decarbonization and climate resilience to the health system. And finally, develop an initial plan to increase the resilience of the health systems vis-à-vis the estimated climate impact of the population to engage with key partners to achieve meaningful adaptation. So, as I said, today is the second session of 10 sessions that we had in the 8th of April. So I remind that we have a session every Tuesday. Can continue that with the learning objectives of today's presentation that will focus, as I said, on the concept of climate change and health vulnerability and adaptation assessment, and particularly how such assessment form the basis of the preparedness and resilience of every health systems. So that includes improving evidence, understanding the links between climate and health, identifying population at risk, vulnerable population, produce robust evidence of current and future projected health risk, establish a baseline to monitor these changes in risk and associated policies and programs, support the development of collaboration with decision makers in other sectors in order to reduce risks to health, and then identifying adaptation options for adjusting existing policies and programs and for developing new ones. And the second objective, global objective, is to identify and use these available frameworks, methods to undertake a climate change and health vulnerability and adaptation assessment. So just a reminder, once again, today has all the sessions for 90-minute sessions. So we have an expert lectures of approximately 40 minutes and 2 case studies presentation of 20 minutes. This session will terminate with a Q&A section. So you could ask your question during all the presentation, but the question will be asked to the presenter at the end of all these 3 presentations. So then you can enter your question during all the session in the Q&A box. This session will be recorded in live, and the slide decks and the resource and the recordings will be made available on the course website at the end of the session. So to remind also that the attendance is automatically recorded with your email during the live Zoom sessions. Attendance and your attendance will be only counted if you join using your personal Zoom link. So it's very important to use your personal Zoom link and to use your link. And the YouTube views will not count toward attendance. So be very careful with that. So at the end, if you participate more than 70% of the live session and pass the final exams with a score higher than 70%, you will be awarded a certificate of participation in climate and health from ASFER GCCHA. And so this final exam must be completed using the same email address used to attend the Zoom session. This exam link will be sent on the final day of the class, so the 10th session, via email and WhatsApp, and will close on Sunday. So we'll have approximately 1 week to complete it. You will have approximately 25 multiple question, true and false question or multiple choice question. And you have to be prepared to take in one sitting these exams. So I finish this reminder regarding the logistics, so I can start with presenting the presenters. So today we have the pleasure to have Jörn Birkmann, Vineta Kleinberga, and Gabriella Abruzzo. So John Birkmann will start with his lecture. I will just say a quick words to introduce John Birkmann. He holds a doctorate in spatial planning from the University of Dortmund and a postdoc in geography from the University of Bonn. He's a well-established academic in the fields of spatial planning, environmental sciences, disaster risk reduction, and climate change adaptation. He's a professor in the University of Stuttgart and is leading the Institute for Spatial and Regional Planning. He has a particular focus on issues related to disaster risk reduction, climate change resilience, and sustainability. His work often bridges the gap between scientific research and practical application for policymakers and local communities. He has published extensively in peer-reviewed journals on vulnerability, climate change adaptation, and is also the head of section at the United Nations University. He has been coordinating lead author for the IPCC fifth and sixth assessment reports. So Jörn, the floor is yours for giving your presentation. I just stop to share my
Thank you
screen.
very much, and good morning, good afternoon to everyone. It's a big group. Actually, my expertise is a bit limited, but I'm actually a spatial and urban planner, so my view is particularly on how future climate change will lead to more extreme events and how does this actually change the demand side, but also the supply side. I would share my presentation in order to make it a bit more visual. As indicated, this session is about methods to assess the vulnerability and adaptation options of the health system. So my first question was a bit, what is a health system? Since I don't know what a health system is, I said, okay, maybe we try to look at people who need assistance in terms of health issues, but also, for example, some infrastructures like hospitals are potentially key. So my presentation will look actually at methods to assess the differential exposure and vulnerability. I differentiate exposure and vulnerability because you might be exposed to heat in Nigeria or in India or here in Europe, but at the same time you're not as vulnerable as some other persons. And also I would like to outline some adaptation options, and as I am particularly also coming from the field of urban and regional planning, I would also try to outline a bit what can infrastructure providers like hospitals do, but also what has to be done at the level of cities. Let me start with an introduction. Actually, this picture is from Stuttgart. Here also in Stuttgart, it's a city in the south of Germany. We have increasing heat and low wind velocities. And in the international discourse, particularly the IPCC, there's a large agreement or high agreement that climate risks are increasing because, on the one hand, the intensity of heat stress, like the duration and the temperature, is increasing, but also the exposure. A lot of people today live in cities, and in cities we have next to the temperature also the so-called urban heat island effect. So here actually heat will be, we experience more heat in cities tentatively compared to rural areas. In addition, for example, here, if we look at Europe, and the presentation is a bit experience from Europe, we have in some societies, particularly also here in Germany, increasing aging population. That means also tentatively our vulnerability, our human vulnerability is increasing. Second introductory remark, complex linkages, for example, between health services, critical infrastructures, electricity, water supply, etc., climate change and human vulnerability are not sufficiently considered, particularly if you think about emergency management, hospital planning, or urban and spatial planning. So often we tend to focus on one specific area, like a concept for the health sector or for a specific hospital, but we don't take into account how this might affect the services that go towards a hospital. Third remark, climate risk. We are talking in the IPCC often about climate resilient development, and resilience is often associated with issues or characteristics of robustness. However, it's important to understand that climate resilience health systems or infrastructures encompass aspects of robustness, like being able to buffer heat, but at the same time, resilience is also about learning from crisis. And here we have also some experience in Europe with different heat waves. If you look at the international discourse, there's an agreement that we will experience an increase in the global mean temperature. And in a, for example, 1.5 degree global warming world, it still looks nearly similar to what we observe today. But if we move towards a simulated change of 4 degrees average increase of the temperature, you particularly also see the global north, the North Pole, which is increasing in terms of the temperature significantly more. So if in a 4 degree plus world, we are not just having 4 degrees plus everywhere, but for example, in the global north, we have up to 6.5 to 7 degrees more temperature. So this has severe implications on the one hand for glacier melting, for the ice sheets, but as well, for example, for the temperatures within cities worldwide and particularly also in the global north. Second question is a bit, if we talk about heat and climate change, it is interesting that climate change is not only linked towards changes in the mean temperature, it's also linked towards changes in extreme events, particularly in terms of heat stress and heavy precipitation. If you talk about flooding, the link between flooding and climate change is not as strong as for heavy precipitation and heat, because in the context of flooding, particularly for larger watersheds and rivers, it is also the land use that is important. But here, if you ask yourself, what is an extreme event? We normally see extreme events like heat stress phenomena as the 10th or 19th percentile, so on the end of the kind of distribution curve here. However, if you look at the lower picture, and that is from an IPCC special report we wrote in 2012, the whole curve is shifting. So what we have experienced, or what you experienced, for example, in West Africa in 2003 as an extreme event, extreme heat event, might be a normal event in 2030, or at least not as extreme as in 2003, because the entire curve is shifting. And that also means we have to carefully think about adaptation needs and adaptation options, for example, in the health system. The IPCC definitely moved from a prior focus very much on the physical side of climate change, which is working group 1, also to the topic of human vulnerability, adaptation, risk issues. And this is potentially also quite relevant for the health system, because we are not just observing how climate is changing, but we want to prepare us for example, different extreme events or changes that will occur within the next 10 or 20 years. The IPCC developed a framework called the risk framework, particularly in the 5th assessment report. The IPCC is a global network of it's an intergovernmental institution, but the IPCC reports are written by about 200 authors for each working group every 6 years. And for example, these are called the assessment reports, and they try to collect or try to systematize the current state of knowledge. And this diagram was quite important in the 5th assessment report, because it shows we are looking on the one hand on the left side towards climate, the natural variability, anthropogenic climate change. They modify hazards. So physical phenomena like heat, temperature, precipitation phenomena, these are changes of the physical environment. And at the same time, it's important to understand what are changes and structures in exposure or vulnerability. Here in the IPCC, in the 5th assessment report, we try to differentiate exposure and vulnerability, because we see that, for example, a lot of cities are exposed to heat, a lot of people are exposed to heat outdoor in the outdoor climate. But for example, in cities like Sydney, Melbourne, you have a percentage of households, 80% of the households have air conditioning, while this is unlikely to be the case, for example, in cities like Dhaka or in some other developing or emerging economies. So here the difference between exposure and vulnerability is quite important because vulnerability is something which is a characteristic of a person or has to do with your socioeconomic conditions, with your ability, for example, to buy buffer capacities or to have, for example, equipment in place that helps to buffer these kind of emerging hazards. Vulnerability and exposure are particularly influenced by socioeconomic pathways. In a lot of countries, you're coming from, for example, we see a trend towards urbanization. More people are living in cities. Also, particularly, for example, the rate of urban growth is very high in Western Africa. And also here in Europe, the percentage of people living in cities is significantly higher than in rural areas. And therefore, for example, the exposure to heat stress is a little bit higher because we have the additional urban heat island effect that influences, for example, our experiences in terms of heat stress. In addition, the diagram also shows that there are adaptation and mitigation strategies. A colleague will talk later on mitigation options for hospitals. But as said, for example, we are also particularly interested in issues of how could the health system adapt to, for example, intensifying extreme events like extreme heat or maybe extreme precipitation. One of the other figures in the IPCC tried to link strategies towards this propeller diagram. And as you can see, for example, for the hazard side, the blue, dark blue side, climate mitigation, reducing CO2 emissions is an option to reduce the increasing temperature and therewith in the long run also some hazards. If you think about exposure, it could be, for example, active or passive cooling systems. Also, early warning systems can help to reduce exposure. If you're warned, don't go out during the lunchtime because the temperatures will reach over 45 degrees. This could be something like an early warning system that helps to reduce your exposure. You stay indoor and try to stay in cooler places. And vulnerability, for example, is here associated with effective public health infrastructures, most likely information, but also facilities of health infrastructures, but also issues around insurance systems or livelihood diversification. If we look into the newest IPCC reports, again, there's definitely a significant change in extreme events, particularly linked to heat and heavy precipitation. The first diagram here in red shows hot temperature extremes over land. So also the ocean is warming, but if you talk about health facilities, most of them are on land and also cities and people, and therefore hot temperatures and the temperatures over land are more important for these direct impacts we will experience. And as you can see, for example, at present we have a 1-degree world and it's getting hotter, but in a 4 degrees world, for example, it is 9.5 times more likely that heavy heat phenomena will occur. So this shows within an increasing global average temperature, we will have significantly more heat stress in terms of the frequency, so how fast or how often these kind of phenomena occur, but also in terms of the length. So the duration of some of these heat phenomena will be significantly higher. In addition, the opposite to hot, too much water, heavy precipitation events, if the air is warmer, there's more opportunity to store that water is stored in the air. And then, for example, these heavy precipitation events, which we normally associate with phenomena in Asia, are more likely to occur. Also here in Europe, we had heavy precipitation events that had a major destructive or lead to major destruction. And in a 4 degrees world, for example, it's nearly 3 times more likely that there are significant heavy precipitation events in the future. If we go from the physical analysis towards the question, what does it imply for health infrastructure, for the demand of health services, then the IPCC, I modified some of these conclusions a bit more towards the health sector, but it's clear that health infrastructure, health services, but also vulnerable groups like elderly, people with adverse health conditions experience already adverse impacts due to climate change. So we are seeing already the impacts of climate change and not only talk about a phenomena that could occur, that was maybe in 1980, 1990. We were not sure whether these kind of phenomena would really impact us, but now we know we can already measure impacts of climate change or phenomena that are also influenced by climate change, like these extreme heat phenomena, extreme heat days. In addition, these impacts, that is also important, are not disappearing in the future, but are likely to increase in the future due to climate change. So actually, the health system has to be prepared for not only responding what we know from the heat stress or from the heat wave in summer 2003 in Paris or in Germany, but we have to be prepared, better prepared actually to respond to heat waves in the coming years because it's likely with increasing climate change that these phenomena are intensifying. Second point, in the near future, climate-associated risk, here vulnerability, exposure, and the hazard to natural and human systems depend more strongly on changes in vulnerability and exposure. So it's not just the question how the climate is changing, but also due to demographic changes, at least here in some countries in Europe, due to a higher number of people that is exposed to heat. These factors are quite important, and it's not just the hazard phenomena, the temperature or the precipitation, also the exposure of peaks that is positive. Also, for example, heat warning systems do exist, heat plans are developed, but often these plans or these strategies are still insufficient to deal effectively with future change and climate resilience of health infrastructures and services, particularly for most vulnerable groups. And here I differentiate between resilience of health infrastructures and health services. Infrastructures are particularly, for example, physical buildings of hospitals, while services could be much broader set of services that hospitals or health systems offer. Interestingly, also the IPCC tried to look at what are the synergies between adaptation and mitigation, and the next colleague will outline a bit more what can be done in terms of climate change mitigation in the health sector. But if we look at this kind of broader assessment, we see, for example, that critical infrastructure networks and services and hospitals are one of these elements. Can have an effect and a synergy with mitigation, with CO2 reduction. If we talk, for example, about urban greening and shading. So if you try to have outdoor shading to reduce heat exposure of patients, then this has also a positive effect for the mitigation part. This is, for example, less the case if you think about a warning system via mobile phones. It's a warning, but it has not a mitigation synergy in terms of climate or greenhouse gas reduction. However, for example, if you think about human health and health system adaptation, it seems to us in the IPCC that there's a mitigation potential because often these kind of strategies are linked with the accessibility of green spaces, cooling, etc., that are also having a benefit for the mitigation part. Let me take you to the state where I'm located. Actually, I'm in the state of Baden-Württemberg. There's the city of Stuttgart, a lot of car-producing industry here. But you can see for these two maps are quite important. They show the increasing heat stress and exposure to heat stress in the state. And the first one shows the absolute number of hot days in 2000, in the year 2000. And the other one shows the absolute hot days, the absolute number of hot days in 2022. And what you can observe, for example, I mean, here, these agglomerations, the city of Stuttgart with 600,000 inhabitants, but also here other cities around, definitely will be more exposed to heat stress in the future and already experience much more heat stress. Also here, this is where the River Rhine is located, going from Switzerland towards the North Sea. And this is also a hot place. And what was interesting when we looked at urban areas, urbanized areas, highly densely areas, areas of high density, we found that particularly, more dense areas heavily exposed to heat stress compared to rural areas. This might be different in your countries, but at least it's important to better understand what is the distribution of heat, how many people are potentially more exposed or additionally exposed when climate is changing. Next to climate is changing, we also have an increasing population number here in the state, and they are also not just going to the rural areas. Many people who come to the state are going to urban areas, so we have even more people exposed to heat in urban areas. Let me take you down to now the local level. I mean, that's definitely not Lagos or Delhi, a million city or a city with a lot of dynamic structures. This is a typical urban heat structure picture for a city here in Germany. And we see, or you see actually some of the red parts here. And you actually, if you look very precisely, you see bigger buildings. Black elements are buildings, and normal buildings are these small ones. And here you see bigger buildings. And this is, for example, the western part, and the middle part here, the city center, and the upper part here. So if you would use this temperature information as an adaptation strategy to increase the resilience of health infrastructures, or to ask which areas need particularly support in terms of health services during heat waves, then you would tentatively, if you agree, say, yes, it would be the western part because we see a lot of high temperatures here indicated as red, low temperatures as green, and in the middle part, but less here in the east and these parts. But this is only one part of the picture. It's just temperature. We agreed that climate risks are also influenced by exposure and vulnerability. In this western part, these big buildings are not big houses. These are factories and companies. So here in this part, there are a lot of jobs. People are not living here, they are actually working here. In the middle part, you have a lot of houses or people living there also during the night, as well as in the eastern part. Therefore, it's important to understand what is the exposure. During the day, it's also hot, but if you're inside somewhere or in a cooled, air-conditioned factory, the heat stress wouldn't harm you as much as if you would work outside. Or, for example, if you live there in the night, in the middle part, the center, then you experience quite hot temperatures. It's a more significant health threat because your ability to rest, to relax is limited. In this regard, we try to look also into the human vulnerability component, just using the component of demography, aging. You can also use additional indicators, for example, poverty indicators for some parts, for example, in Lagos Island or mainland, etc. There are some phenomena where you can use other indicators, but we used here the demography as a first indicator to better assess human vulnerability, because we know that elderly populations or elderly are normally more vulnerable to heat stress because they don't feel that they need to drink. And as you can see from a federal statistic here in Central Europe, Germany, we see that in 2015, the percentage of elderly was around 5%. This will increase in 2060 to more than 12%. This shows a significant increase in a group that is more vulnerable to heat stress. In this regard, we wanted to overlay it to a very local level, because if we have just a national number, what is the average, whatever, aging population in India, in Pakistan, or somewhere in the United States, it won't help us to take concrete decisions for health systems in specific states or cities. And therefore, we overlaid a little bit this heat map now, the night temperature, but you see still the hotter areas in the west and in the centers with the aging population. And for example, here the blue colors in the circle, particularly 21, 22, for example, or 21, 23 indicate, the first one indicates what is the percentage of elderly on the population within this ward and district, and what is the growth rate of the elderly until the year 2030. Many cities in Germany, many health departments have forecasts of the future population, because it doesn't make sense just to look at the future climate. We have also to understand what might be the future population structure. And here we see definitely a signal that shows we are aging, but this aging is different in different districts. And for example, what you can see here the western part and the center part, they have actually young population. In the city center in Ludwigsburg, younger students are living. Younger students are exposed to heat stress similarly as elderly, but their vulnerability is significantly lower potentially than the elderly population. So, in terms of identifying necessities to address health in different wards in the city here, means that the city center is a hot spot, it's a hot place, but the most vulnerable population cannot be found, are not found in the city center, but actually in the eastern part. So, if you prioritize, for example, programs to educate people in terms of health risk of heat stress, then it would be most appropriate to start rather in the east because you have here a lot of elderly population that is very vulnerable to impacts of heat. We also try to look at then future development trends. I mean, in the IPCC, we use so-called shared socioeconomic pathways. Here at the very local level, we tried also to have somehow storylines. You could also think about your city, what would happen if, for example, the amount of elderly is increasing, or what happens if the city is expanding to these and these areas, and then to, for example, estimate future population corridors, but also future urban growth patterns, as well as, for example, the development of health infrastructures. And here we have then different scenarios, high vulnerability, then the middle of the road scenario, like, aging is continuing, but moderately, and a divided future where you have, for example, very strong divides between young and wealthy households versus elderly with significant poverty problems. And here we are also in the position or had an approach to try to identify specific areas actually at the ward scale, which areas need to be prioritized in terms of interventions. And you can also, this can actually inform, on the one hand, integrated health strategies, but also urban planning, for example, in the terms of providing additional, for example, infrastructures for buffering heat, but also maybe to try to develop area that allow a mixed use so that these are not just aging old areas or where trying to avoid that there's an accumulation of very vulnerable groups in one area. Let me come to a small conclusion. I think it's important if you think about the assessment of vulnerability and the vulnerability of the health system. On the one hand, to ask what is the demand side? Who would need support? Who would be adversely affected particularly adversely affected by heat stress or heavy precipitation? And here the identification of most vulnerable groups is helpful. This can be overlaid with, for example, the changes in heat exposure, heat stress in a city. And these kind of combined scenarios allow you to assess areas that are highly exposed to future heat stress or present heat stress, but also which are highly vulnerable. So this combination makes sense. It's a bit different than just looking at temperature, but it helps potentially to think of a more integrated assessment strategy. In addition, these kind of integrated assessments allow also to better specify adaptation needs. This means, for example, that you, on the one hand, can change the physical structure, you can provide more green, but at the same time, you might need specific care units, specific warning systems for these aging population groups or particularly elderly groups that are very vulnerable. So here, I guess, or my understanding is that through this kind of scenarios, combined analysis, we get a better picture on how health systems, health adaptation, exposure, and vulnerability and the hazard side. You cannot change the entire climate, most likely in one city. Even in big cities, a lot of, for example, cold air streams are coming from the surrounding areas. So here, additional planning and adaptation strategies are needed. Let me take you now to a very different phenomena because this session is about vulnerability and adaptation to climate change in the health system. And I would like to bring you now towards a very concrete example of the health system infrastructure, hospitals. And this is here the city of Stuttgart, and this is a heavy precipitation map. A heavy precipitation map is different from a flood map. A flood map occurs at a river, it's clear, but heavy precipitation phenomena here, for example, in Europe, but also in Asia, it could rain everywhere. And then, for example, streets are flooded, infrastructures are damaged. And if we look at the heavy precipitation, we see that it's mainly in the center. And some of these hospitals are actually also affected. The city of Stuttgart, as a major city here of the state, has a lot of hospitals. So actually, these hospitals are also serving surrounding areas and are very specialized. The differential coloring system here in terms of the blue colors shows you the water depths. However, if you have been once in a flood, doesn't matter whether it's heavy precipitation or river flooding, you might notice that the depth of the water is not the only thing you need to worry about. It's also the velocity of the water. So even in 30 centimeters high water, you might walk through if it's like a lake. But if it's a very fast floating river or water stream, it's very unlikely that you can pass it as a person or with a vehicle. And therefore, if we look then, for example, into very specific areas here, just to give you an example, what the discussion is at the moment, here we see a major hospital that has 1,500 beds. It's quite big. It has very specialized surgery rooms, all in the basement, could get flooded. And as you can see, this hospital, there are some blue areas around it, but it's not the major area. Actually, the major area is here where our university is. So we got more flood. Luckily, I only have a laptop. I'm not sitting in a bed, or most times I'm not sitting in a bed. I'm teaching like this time. But the hospital also, there are some areas, for example, entrances where heavy precipitation could enter into this hospital with 1,500 beds. And if you look at the velocity, these yellow and orange and red lines, it's quite important that the access roads to these major hospitals will have a significant velocity. So it's very unlikely that a normal patient or a emergency management unit could somehow drive over this street towards the hospital when there's an extreme precipitation event. And this is, I would say, also an important information because it's not just a question whether the hospital itself could be flooded by heavy precipitation, but also how far the access routes towards these hospitals would mean that you cannot somehow get medical services or health services in case you need them. In addition, you could think, okay, we have also some hospitals on a hill. That's right. I mean, Stuttgart is quite hilly. And here you have, for example, a large hospital again with more than 800 beds on a hill. It's very unlikely that if rain drops down from the sky, that this stays on the top of the hill. Therefore, the hospital itself, the facilities are safe. But if you look at, for example, the water accumulation due to heavy rain, then we see that larger streams, larger pathways towards these hospitals will be most likely blocked and impacted. So again, the accessibility of services might be limited. And here, one of the interesting questions emerged today. What are the different services that a hospital offers and needs? For example, one case, definitely you need, if you're a patient, you need to be transported to the hospital. That's clear. That's a very, very clear picture. But what happens, for example, if the hospital doesn't get different medical specialized medicine, or for example, oxygen, or for example, if there's a breakdown of the communication infrastructure. In Germany or in Europe, we are heavily specialized. For example, you have emergency cars and hospital operations, but often they depend on mobile phone connection or networks. What happens if this mobile phone connection breaks down? Then your GPS, even for driving these vehicles, is lost, or you don't see any more traffic stuck because you're not connected anymore with the GPS system. As well as you cannot talk to the doctor in the hospital. So here a lot of communication breaks might occur, and this also is, I would say, quite important risk that has not been sufficiently considered when you talk about climate change and assessing the impacts of climate change and vulnerabilities towards the health system. This is an ongoing discussion. We have not yet convinced too many hospitals that they should take a look at that because they say, oh, we are already overburdened with our normal work. But in our scientific approaches or now in terms of the scientific interest, I think it would be highly relevant because we are on the one hand highly technical today here in Central Europe, but at the same time, the high use and dependency on technical systems, communication, electricity makes us on the other hand, quite vulnerable to such impacts. Last, or some of the final slides also here, I think it's important to better understand the supply deficits. And if you talk about cross-sector cooperation, it is not sufficient that a hospital is running. You have to think about the services that this hospital is depending on in order to be effectively running. And for example, it could be the blood supplies, could be the medicine, specific medical treatment issues or things that are needed and that cannot be brought to the hospital. Consumables, hygiene is an important issue. Oxygen might be something, as well as food. I mean, if you have 1,500 patients, you need a lot of meals. If the traffic is blocked, streets are blocked due to heavy precipitation, the patients don't get meal. If you're anyhow there to get a diet, then it's not problematic. But if you have, for example, a specific need for eating every time normal meals, then it's quite important. Last but not least, it's also the personnel. So it's not only a question whether they get oxygen and blood supplies, but at the same time, you might have personnel, doctors that stand in the traffic stack that don't get back to home or that cannot go from home to work. And these longer travel times are potentially also a certain threat that needs to be assessed. In this regard, I would recommend if you want to conduct some of these surveys, I would say look at some of these direct impacts, what kind of direct impact can be expected if you think about heavy precipitation in hospitals, the facilities, the location of the hospital is clear. But in addition, maybe it's a dialysis stations or day clinics are quite important. For example, maybe these kind of facilities have less protection and are located in areas highly exposed to heavy precipitation or even also to heat stress. Also in a hospital, if you have a lot of patients that are barbecued by temperatures of more than 40 degrees, it gets quite tricky. If there's, for example, air condition, it's potentially fine indoor, but it might be also useful to think about heat stress and the location of the hospital. Indirect impacts are important. The emergency services, as I indicated, you might have emergency services that cannot fully operate effectively under conditions of heavy precipitation. You might need a redundancy in the system. You might have indirect impacts on the preventive or rehabilitation facilities. Therefore, I would say one of the urgent needs to better improve the assessment, but also strategies for climate resilience health systems is a better cooperation along different departments and actors. And this requires a cross-sector collaboration, particularly moving from the individual focus of one hospital that is definitely operated often by one company or by one city to the broader understanding of services and supply networks. And here, in order to better capture these supply networks, you need a cooperation between individual hospitals, healthcare departments, fire brigades, urban planners, etc., transport planners, in order to understand these kind of dependencies on networks, but also to ensure that within extreme events, be it heat stress, be it heavy precipitation, the health system can effectively respond and support people. Let me come to the conclusions. Methods to assess exposure and vulnerability of people to extreme events are important to better understand the demand side. So if you look into the city again and the heat stress, we see that certain areas are heavily heat exposed, and it's likely that they request more support during heat waves. However, as we said, or as I showed, also we have to think about the vulnerability and risk assessment in terms of hospitals and critical infrastructures, and move away from an individual building perspective towards networks. Current methods therefore need to better assess and capture the resilience of supply networks and broader medical services and these interdependencies. And therefore, strengthening the resilience of health systems requires changes in both in the physical structure, for example, greening of hospitals, buffering capacities, but also in terms of methods you conduct. So it's not just about the physical change, it's also about the methods you apply. and this requires cross-sectoral cooperation. With this, I would like to thank you, and here's some literature if you're interested. The IPCC report, some of the examples I showed. I hope I could give you, even as a person which is not working in the health system, some impressions what I think would make health systems more resilient. Thank you very much for your attention.
Thank you very much, Jörn, for this very interesting presentation and to enlarge this perspective regarding your actual thematics on urban planning. I found it very interesting to have this perspective and to remind that we have to have on vulnerability exposure, and that as a urban planners also we have our share to do to reduce the vulnerability of our cities to some extreme hazards, extreme events in a hotter future and more risky future. So thank you very much for respecting the perfect little time also. So I will now give the floor to the two case studies. Actually, we have Vineta Kleinberga, which is a researcher at the Faculty of Social Sciences and the leader of the research group Intersections, Politics, Narrative and Perceptions at the Social Sciences Research Center at Riga Stradiņš University in Latvia. She's a political scientist whose research focuses on the dynamics between policy formation, strategic communication, and societal perception. So our latest research evolves around climate and energy policies and the communication and reception in Latvia. So she holds a master's degree in political sciences from Central Europe University. So Vineta, I will let you for the 15-20 minutes presentation. I give you the floor. Thank you.
Thank you, Ianis. Good morning, good afternoon, good evening to all of you who have joined the course from all over the world. Hello from Riga, Latvia. I'm very pleased to provide the case study of Latvia to you from a university which actually is very well known internationally as a medical university and specializing very much on both the public health and different medical education. Shortly about Latvia. Latvia is a EU member state since 2004. We are located in the Baltic region, Northern Europe. We are not a big country. We cover approximately 65,000 square kilometers, and our population is small compared to the countries, to your countries who have actually joined today. So we have 1.9 million people here in Latvia. We are located in a temperate seasonal zone, so our climate is mild. But what we can say is that we also feel the effects of climate change, and research shows that since 1991, the average temperature in Latvia has increased by 1.2 degrees. And it may seem not that much, but we all know from the IPCC reports that actually the global aim is to limit the global warming up to 1.5 degrees Celsius. Unfortunately, we have already reached these limits, so we have to actually strive more to mitigate climate change. But what it means for Latvia, so it means that we also see more frequent weather extremes, which Jörn was talking about, which we experience here as heat waves and longer heat waves during the summer season. We also have more heavy rainy precipitations, which very frequently result in floods. We have milder winters with less snow, with more precipitation, which also means that actually many species and pests are proliferating, which influences agriculture and also the everyday life of the people, also the health, and so on. So though we are not located in the north or in the global south or in the Pacific, where you feel the climate change affects more than we do, we feel them here as well. Just to probably frame my today's talk a bit. So what does climate change mean for the healthcare sector? Jörn was talking already about ability of and exposure of people to the changing climate, and what does it mean for the healthcare system? It means that it actually has to transform to be able to treat all these climate changed induced diseases and health disorders. The World Health Organization has calculated some time ago already that by 2050, approximately 250,000 additional deaths per year will happen due to the climate change-induced diseases, such as malaria, diarrhea, heat stress, malnutrition, etc. In Latvia, there is also research which shows that we actually are exposed to more intestinal infections in the future, to chronic diseases such as cardiovascular and oncological, respiratory, vector-borne, and zoonotic diseases, as well as an increased number of heat strokes. And climate change does not only cause physical diseases, it also enhances mental and psycho-emotional disorders such as climate anxiety and depression. On the other hand, health sector is also one of the sectors which produces the greenhouse gas emissions, and therefore reforms are needed in the hospitals, in the healthcare system to transform the habits. And these reforms, they relate to the energy consumption, to transportation, to waste management, to food utilization, as well as the anesthetic gases which come from the medical facilities. And it's calculated that the health sector globally, it produces 4 to 6% of the global greenhouse gas emissions, and the sector itself has been slower than other sectors to do the decarbonization. And it's also being calculated by one research that if we see the health sector as a whole, that most of these emissions actually come from the healthcare supply chain. It's around 70%. It's from the production, transport, use, and disposal of different goods and services that hospitals use. Then 17% they come from the healthcare facilities, and 12% of emissions come from indirect goods and services such as electricity, steam, cooling, and heating. So how to deal with all that, and how to actually mitigate climate change in Latvia as a case study for today. At Riga Stradiņš University, we are doing research on climate change mitigation, and we are actually paying attention more not to the resilience, but more to the factors which influence the resilience and factors that influence the abilities to effectively mitigate climate change. Broadly, it can be called the socio-economic context, which Jörn was also talking about in his presentation. And we just finished a research about climate change communication in Latvia and climate change perceptions in Latvia, which actually shows that the socio-economic context is not that favorable for climate change mitigation in Latvia. I will show you a few slides later. And recently, last year, we started the project, which actually focuses exactly on the healthcare system in Latvia. And we are looking on the green transition options and practices in Latvian hospitals, and trying to understand what are the challenges the hospitals face, and in the end, provide the recommendations to help them actually to participate in the process of green transition. Few slides from our first research. So we actually concluded that climate change in Latvia is not perceived as a very huge national or personal issue. We saw from 2 public opinion surveys in 2021 and 2023 that people perceive climate change as a global issue. And they think that yes, it's happening, but it's happening somewhere else, somewhere in the world, but not that much in Latvia. Then almost half of the population thinks that yes, it is a problem and a challenge to Latvia, and only around 23% of the people think that it can be a personal challenge. And we see a problem with this because it's very difficult to make policies. It's also very difficult to encourage people to do something to mitigate climate change if they are not aware of its effects. And as we talk about it in this course, we all focus on the impact of climate change on health systems, and we also encouraged our policymakers actually to talk more and to focus more on these problems of localization, and to show more how climate change impacts the people's health in Latvia. But that's the thing we will also pay more attention to in the second project. The other issue, the problem with climate change perceptions in Latvia is that climate change seems to be a very minor problem compared to other issues the country has to solve. And here is a table where I have compiled the data from Eurobarometer surveys over 10 years. And they show that only 1 to 2% of the Latvian people consider climate change to be the issue, which should be the most important one at the national level. It's a very, very small share of the population, but it shows the general mood in Latvia, which actually prioritizes security and economic issues, and does not see climate change as a challenge or as part, for example, of security issues. And if we talk about communication, we also concluded in our project that climate change actually is absent from strategic communication in Latvia. What our politicians and policymakers want to talk about is about implementation of EU regulations, and the whole discussion in society and in the business environment, it develops around this technocratic process, and then in the media as well. So we talk about the EU regulation, which is either too ambitious or insufficiently implemented in Latvia, and then the debate is about whether it's adapted to Latvia's specific situation, has the decision-making process been inclusive enough to include all the stakeholders? Is there enough funding for implementation of the European Green Deal? And has there been a sufficient balance between environmental, economic, and social goals? And this is the debate we have in Latvia, but it's actually not very encouraging for climate change solutions. Therefore, our recommendation actually is to refocus this debate, refocus the strategic narrative on climate adaptation, to put climate change and climate vulnerability of Latvia at the center of strategic narrative. And then when we talk about our vulnerability and we show how climate change impacts the Latvian people, their properties, their health, then we can also start talking about longer term solutions, which include climate change mitigation events. Now I will go to the second project about the green transition in the Latvian healthcare sector. So against the background which I showed you, where we have a very low awareness of climate change in Latvia, and also not a very big resonance of climate change issues at the political level, it's actually very challenging for the hospitals to be involved in implementation of different elements which can help to achieve lower emissions. But with this project, we try to actually answer 3 questions. We try to see what could be the solutions, how to mitigate emissions from heating and cooling, transportation, food and equipment deliveries, waste management, etc. But we also want to see and help hospitals to do it in a socially responsible way, in order the patients would benefit from that, that they would not have additional expenses. Also for the healthcare practitioners, the doctors, the nurses, in order they would be included in the process and it would not actually complicate their everyday work, which is already very difficult. And we also want to help hospitals to establish these practices in order they enable the emergence of so-called homo climaticus with their activities, that they actually help people to become friendly without people putting much effort into this. But we see, yes, that hospitals have many challenges. Therefore, we have many tasks in our project. One thing is to analyze the legal framework, to see whether the legislation helps or hinders green transition possibilities in the healthcare sector. We do the cost-benefit analysis because, of course, the primary function of the hospitals is to provide healthcare. And then we want to see whether there are some mechanisms which could help them financially to invent the carbon-free solutions. We also focus on the perceptions, and we focus on the perceptions of both of the healthcare practitioners. We have recently started the case studies in 4 Latvia's hospitals, but we are also going to explore the perceptions of healthcare receivers, of patients, organizations, of their relatives, to see what could be acceptable in Latvia's situation. And then in the end, we plan to provide recommendations and the roadmap for a pilot project in a hospital, co-creating these recommendations together with the stakeholders. I will tell you briefly about a pilot study which we carried out in one Latvian hospital. It's a Strenci Psychoneurological Hospital. It's located in the northern east part of Latvia, 130 kilometers from Riga, in an old historical building and a very nice area, very green area. And this is a small hospital. It has 302 employees. 80% of them are medical care and rehabilitation specialists. Around 20% is support staff. But this hospital actually has been a forerunner in Latvia in inventing climate change mitigation solutions. And the hospital is doing it voluntarily without any special support or pressure from state institutions or any other institutions. So what has the hospital done already, and what do they do? Very enthusiastically, actually, and the whole team has been very much involved into this. So since 2016, they have their own guidelines for environmental protection. This is a green area, an old park, old buildings, and they want to preserve the whole area, both for their patients, to whom actually being out in the nature is one of the prescriptions how to heal themselves better. But they also want to preserve and open this area for the local community. And what is the most important thing, what they said, is that actually the first thing is the awareness and realization of the emissions you and your facilities make. So they calculate their greenhouse gas emissions every year, and they monitor their reduction. And they have invented some solutions already to reduce their energy consumption, both in electricity and heating, and to increase energy efficiency. For example, they have installed the solar panels for autonomous electricity production. They have insulated their historical buildings. Last year, they got the third place in the category, the most energy efficient public building in Latvia. They have put LED bulbs and light sensors everywhere to save energy. They also work on reducing the transport emissions by introducing electric vehicles for technical and support functions. They put a very strong emphasis on educating their employees about energy saving and waste reduction and different opportunities for circular economy. The legislation currently, it doesn't allow them to make green procurements. Therefore, what they can do is they inform their suppliers about the hospital's approach to sustainability. And as I said, they open the territory to local community and protect the nature in the whole hospital's territory. So I will stop here. The only thing I want to say is that actually you don't need very much pressure or lots of money or particular legislation to introduce reforms. Very important is the motivation of the headquarters, of the employees to do the reforms. And we see that in case of Strange Psycho-Neurological Hospital, it works very well. Thank you very much.
Thank you very much, Vineta, for this very interesting case study. So we will quickly move on the second case study. So I will just briefly introduce our second speaker. Gabriella Abruzzo is a climate projects officer at the Healthcare Without Harm Europe. She focuses on the healthcare sector's climate resilience, particularly through the EU-funded project Life Resource Star and the Montadapt project. So, Gabriella, I will let you the floor for giving your presentation.
Hello, everyone. Thank you for the introduction. So, I'm Gabriella Abruzzo, and I think you can see my screen now, right?
Yeah, it's good now. Thank you.
It's good now, okay. I'm Climate Project Officer, Healthcare Without Harm Europe. Healthcare Without Harm is a network of thousands of hospitals, healthcare professionals, and healthcare leaders. And we exist to create a more sustainable healthcare sector that does not harm to the patients and our planet. Regarding climate resilience, the work of Healthcare Without Harm focuses on two EU projects, Life Resistant, that has the goal to develop resources that increase the resilience capacity of European healthcare system and related critical infrastructure, and the Mount Adapt project that focuses on European mountainous areas and work to limit the impact on health and well-being of direct and indirect effects of climate change. And we disseminate this work through our network, the Global Green and Healthy Hospitals. Today, I will focus in my presentation about the Life Resistant project. The project has arrived in its last year and is composed of a consortium of 6 technical partners, 2 health systems, and 7 pilot hospitals. Inside the project, there are as well some additional network, like the Scaling network. There is a network of hospitals that have access to some of the resources developed during the project, as well as with some limitation to some tools, and the facilitation board that is a network of experts that support the technical partners. So what the Life Resistant project wants to do is to facilitate and promote climate resilience and produce climate resilience innovative solution, but as well engage with the stakeholders and policymakers through the community of practice. The community of practice is a network of external stakeholders that can support the hospitals, the pilot hospitals, in increasing the climate resilience. Regarding the concrete result achieved by the Life Resistant project, we have the EHESP, the upscaling adaptation starting package that consists of methods, tools and best practice that have been developed throughout the project, and the toolbox that contains the tools that have been developed by the technical partners of the project. Today, I will only focus about on the first 3 modules of the project that are related more to the assessment of vulnerability adaptation, so infrastructure, assets, people, climate hazard, and risk and vulnerability. But before going to the tools, I would like to present one of the resources developed in the project, the practical guide for building climate resilience health systems that has been developed by Healthcare Without Harm Europe and created with insight from Life Resistant pilot health systems. The guide is general enough to be applicable to any European health systems and has the goal to help organizations integrate climate resilience into healthcare planning. It is divided in 2 parts. The first part is an introduction to climate impacts and climate resilience in healthcare. So you will find key definitions, and also is highlighted how climate resilience does not depend exclusively on the capacity of a system to adapt to more frequent and severe extreme weather events, but as well on its capacity to decarbonize operation through climate mitigation measures. And as well, in the guide, we present some of the impacts on a system that are divided in direct. So that, for example, is damage to hospital infrastructure caused directly by extreme weather events, but as well on indirect extreme weather events. That, for example, is a degradation of critical infrastructure that are essential for a healthcare facility to function, to operate, to provide the healthcare service, like the transport network of the water supply network. Here in this slide highlight the impact also on health, because due to extreme weather events, obviously patients will arrive to the healthcare facility with particular kinds of illness and diseases, and as well the continued exposure to extreme weather events will deteriorate their health, as it will deteriorate the well-being and mental health not only of the patients but also of the healthcare workforce. In the Montaudat project, the Hamburg Institute of International Finance Economics has published literature review on the empirical evidence of effects of climate change on non-communicable diseases. The second part of the guide presents a step-by-step approach and outlining the essential actions to increase climate resilience and giving some insight for implementations. These steps are flexible in general, so to be applicable in independently from the structure of the different European healthcare system. And I will focus exclusively on step 3, assess climate risk, and step 4, identify priorities. So assess climate risk is fundamental for healthcare system and healthcare facility to make well-informed decisions, set priority, design appropriate action, and allocate resources. The guide is meant to be used by a system. So what our advice in the guide is for a system to mandate to individual facility to conduct a vulnerability risk assessment, favoring a bottom-up approach to ensure the quality and accuracy, and then the results of the individual vulnerability assessment should be aggregated to provide an overall picture of the level of risk of the health systems. In the guide, we mention different tools that can be used to assess vulnerability and risk, but today I will only focus on the one from Life Resistal, that has been developed by the Greek National Center of Research Democritus. And as I said, it corresponds to the first 3 models of the Life Resistal toolbox. So infrastructure, asset, people, and climate hazard and risk and vulnerability. So to these tools, what you should provide is the healthcare facility background information, such as the type of healthcare facility, the location, and the height. And then you will select the climate scenario and the climate hazard. In the tools are present 3 climate hazards based on the project that are heat waves, floods, and wildfires. What you will obtain is a vulnerability assessment. So the tool will tell you how vulnerable is your healthcare facilities, and these present 4 different categories. There is health workforce, wash and healthcare waste, energy, and lastly infrastructure, products, and technologies. And the vulnerability is classified as low, medium, and high. Then you will have the impact assessment. The tool will provide you a list of impact based on a specific climate hazard, and you can also have the classification as low, major, or medium impact. The last thing that you will obtain is a risk assessment that will combine the climate information with the impact. In this case, you will understand how at risk is your healthcare facility. And going back to the guide, then after you have completed a vulnerability risk assessment, you will then identify priorities. The identification of the priorities obviously does not depend exclusively on the vulnerability risk assessment results, but as well on other factors. The guide presents 4 different priorities areas, but this might change due based on individual systems. And the one present in the guide are infrastructure, supply chain, healthcare workforce, and WASH. If these priority areas are impacted by extreme weather events, obviously the healthcare service and the health of people will be deteriorated. I will invite you to discover the guide, and I will put all the useful link in the chat also about the Life Resistal project. The last aspect of the Life Resistal project I would like to talk about is the experience of the Galician Health Service, or SERGAS, in the project. The SERGAS participate in the Life Resistal project with one of this health area, the one of Ourense, Berin, and Barco de Valdeorras. What they did in the project was obviously to assess the capacity, the adaptation capacity to climate change, and they have identified 3 major climate hazards that are impacting their service. That these 3 major climate hazards are heat waves, wildfire, and heavy storms. And in the graph, you can also see the result on the capacity assessment that the health area has conducted, and this has been based on interviews done inside the health area. And they also have established a community of practice. So they have established relationship with external stakeholders that will support them in increasing the climate resilience. They also have selected some measures that will reduce the impact of extreme weather events. They will implement one per each hospital in the project, so a green pergolas for in Ourense, a green roof in Berin, and a rainwater collection system in Barco de Valdeorras. So the hospital will use climate data and improvement to assess the efficacy of measures, and the ultimate goal is to help healthcare system achieve fast, cheap, and efficient measures to improve climate resilience. To conclude, I want to highlight that the healthcare sector must become resilient to the impact of climate change and support community health against the associated health risk. Assessing the impact of climate change on health system can guarantee the provision of healthcare service and protect people's health. A climate resilience health system is a vital element for a climate resilience community, and we must assure the healthcare facility will be the last building standing in a time of crisis. Thank you.
Thank you very much, Gabriella, for this very interesting different case studies, in fact. So we have a lot of questions, so I will try to be very brief because we have only 5 minutes left. So maybe the first one, and maybe that's something that you can also react on, Gabriella, is the first one is for Jörn. It's related to the urban planning, and the question is related to the effectiveness of using associated with heat stress. Do we have any measures, any data that we can use in terms of implementation? And that question could be also related to the healthcare sector and the projects of Gabriella.
Shall I start? Yeah.
Oh, yeah, please.
My feeling is, I mean, definitely it depends on the question, what is the adaptation need? I mean, if you have very serious already adverse health issues, then it's unlikely that green space helps. On the other hand, we know that during COVID, a lot of people didn't like to stay always at home. So I think staying in a shaded place normally allows people to to buffer heat stress. But definitely if the temperature is over 40, 50 degrees, then it's unlikely that you can stay long outside. But often what we have with observations in countries in Asia, but also here in Europe, a lot of people actually say that their buffering capacity is either shading or going to public shaded green spaces. And if you are not an owner of a building, it's more complicated to actually conduct physical measures on your own building or on the building. And therefore, this access to open green space, shaded green space is quite important. Without having a specific detail at what temperature, it's not anymore an adaptation measures or an appropriate adaptation measure. Thanks.
Thank you, Jörn. Maybe Gabriella, you want to elaborate relating to the effectiveness of the green measures you implemented in your projects?
Yes, I would say that the green measure is not fully implemented, so they are currently being implemented in the project, but obviously the presence of appropriate green measure will decrease, in this case, the heat exposure, not only of the patients, but include the people visiting the hospitals and the healthcare workforce. And this will have, I would say, multiple benefits that can go from obviously climate mitigation, because you will reduce the use of some types of air conditioning, and so we will inevitably emit less, but it will have also effect on adaptation. So reduce the heat exposure of people, but as well, we believe that it's also good for the mental health of people to have to not be surrounded by only by gray, but also some green spaces.
Okay, thank you. Maybe I have another question for Vineta. This is a question that is related about how we can integrate all this health evidence regarding climate changes into health climate policies. Do you have some specific values, example of Latvia to see how it is implemented in policies on the local and regional national level, for example, and how it is implemented?
It's not an easy question to answer. Thank you. I think it's a very complex set of measures which should be done, and it can also, yes, be done at national, regional, local levels. Probably at the moment, we do not have concrete recommendations for the policymakers regarding the healthcare sector, but we are working on it and will be working on it. I think it's very important to see what actually works, and for this, all the good examples and good practices which come from the bottom up are very important. Because at least in Latvia, we have this practice to invent reforms from the top. And if you invent them from the top, then people first perceive them as a pressure, and second, they cannot be very tailor-made to specific hospitals. Therefore, our project aims to understand what could be very usable to concrete hospitals, and coming from this to introduce and to propose reforms at the policy level. One thing which is very important and which has already come out is about the public procurement, because for example, if the hospitals would like, even if they would like to buy equipment which emits less emissions, they are constrained by the legislation, which requires them to buy the cheapest product, right? So that would be one recommendation, that we should actually adapt the legislation in order the hospitals would be able to choose among producers which produce equipment, food, etc., in a sustainable way.
Okay, thank you for your answer. Another question is that maybe also I totally understand that we need more bottom-up approaches to better tackle the effect of climate change on health system. One other question is related also to the focus we are pointing completely on the urban population. As an example, you presented how a city like Stuttgart is analyzes and assessing the climate risk in the future climate. But what is being done actually to address rural health challenges, as these communities can have sometimes limited resources? So maybe you could you could answer the three of us, Jörn, Gabriella, and Vineta, regarding this remark.
Yeah, ladies first, or shall I start?
Or maybe ladies first that time?
Sure.
Thank you.
Oh, I can go first. I think it's a big struggle for everyone in the healthcare sector. The resources, I feel, is more felt in maybe smaller cities. I think also Vineta said in her presentation that sometimes you don't need big resources, especially when you start. So I feel if the problem is lack of resources, we can switch the focus mostly on maybe not on assessment that will require maybe technical competencies and means that are not available, but a good way to maybe adapt a bit in some ways to this is raising awareness and building relationship with other emergency service policymakers, and that will not require a huge amount of resources, but also there are good way to support also smaller hospitals or hospitals located in not in rural areas, I think.
Okay, thank you.
Yes, I can only agree that not everything is about funding. Funding is important and money is important, but not everything is about it, because also like effective things which you do to mitigate climate change, or even to adapt to it, they can provide you some benefits and revenues and savings in the end. So maybe you need to invest at the beginning, but then you actually either earn more or save more later. And this is very important to understand when we discuss about the resources. It's about financial resources, but another thing which is important is human resources. It's very important for people to understand the problem and to be aware of it, and look for innovative solutions first, and second to train all the healthcare practitioners for it. Because without the knowledge, it's also difficult to provide the impact.
Okay, thank you.
Maybe a mini observation, if that's still visible in terms of time. I mean, a lot of hospital planning here in Germany, I would say, doesn't look really, or doesn't focus too much on climate change at the moment, or extreme events. I mean, most likely some of the decisions where hospitals are located are more towards the access to big centers or to medium-sized cities. And sometimes I think they realize, oh, we are now in a heat hotspot and we have to potentially think of how do we provide additional shading, greening, buffering. But also vice versa. A lot of urban planners would say the location of a hospital is interesting, but not the core topic for urban planning. It's more strategic. We have to worry about where to put people, where to put firms, but not individual hospitals. That's their private decision. So I think this sectoral approaches are really something which needs to be strengthened. I think we haven't gone too far with it also here in Germany or Central Europe, so far my knowledge is concerned. Thank you very much also for listening. I have to run into my normal lecture, my paid job soon, therefore I might have to leave soon. Thank you very much.
Oh, thank you very much, Jörn. Yes, we are a little bit late on the schedule, so we have plenty of other questions related also to the transposability of the different tools you have presented. So I encourage you to ask directly the question to the presenters, to have the answers, and I want to to thank everybody, Vineta, Gabriella, and Jörn, for being here today to present in this second session of the course. And I just to conclude, so I wish you a very pleasant evening or afternoon or morning, everybody who is connected to this lesson. We are very, very numerous today. So thank you very much, and see you next week for the third session. Have a good week.
Thank you. Bye-bye.
Thank
Bye.
you.
Thank you. Goodbye.